Hello and welcome to a special foreign policy virtual dialogue, Building Resilience Across Global Health Supply Chains. My name is Ravi Agrawal. I'm the editor-in-chief of Foreign Policy magazine, and it's my pleasure to be your host for the next hour. Now, remember when the world came crashing to a halt last year? Of course, how couldn't you? The lockdowns forced upon us by COVID-19 brought into sharp focus the importance of global supply chains. It made many of us realize that when you hit purchase on a product, that one product is manufactured with the help of dozens of suppliers, who in turn get their supplies from scores of subcontractors, who in turn get their supplies from, you get the picture. Thousands, millions of people are often involved in the production of one thing. And it's not just companies. Supply chains involve infrastructure, transportation routes, last mile distribution systems, storage facilities, oftentimes requiring refrigeration, and of course, the health systems and local clinics that bring it all to consumers. Healthcare supply chains, the likes of which produce PPE or ventilators that we depend on, are global, complex, and also vulnerable. Now, the word vulnerable is key here because that's why we're gathered here today. How do we make global health supply chains more resilient? How do we make sure that the next time there's a big global crisis, and we all know that there will be one, how are we better prepared? What lessons has the pandemic taught us, and what lessons from that can we learn? I have terrific guests today from USAID, the World Health Organization, and from the private sector to discuss these and other important issues. All of that's coming up. First, I'd like to thank Chemonics for helping us make this event possible. And perhaps more importantly, a thank you to you, our audience, FP subscribers and other viewers from around the world tuning in live on Zoom and on social media. We've reserved some time for your questions. If you're on Zoom, click on the Q&A button. Please be sure to tell us your name and where you're writing from. If you're joining us on the phone or watching the live stream, you can email us your questions at events@foreignpolicy.com. And of course, we encourage you to join the discussion on social media. Just use hashtag supply chains for health. That's for the number. All right, let's get started. I'm delighted to introduce our first speaker, Carrie Pelzman. She's currently serving as the acting assistant administrator in the Bureau for Global Health. She's a member of the Senior Foreign Service and has more than 33 years of experience in public health, 2/3 of which was with USAID. She served in 6 USAID missions covering health, education, capacity development, including in South Africa, Afghanistan, India, Iraq, and many other places around the world. Carrie, welcome.
Thank you. Lovely to be here with you.
Likewise, it's great to have you with us. So let's start with this. It's been a difficult year. And I'm curious how the last year of lockdowns and crises have had an impact on your work. And in answering that question, if you could also tell us a bit more specifically about USAID's work for global health supply chains.
Thanks, Ravi. And let me start by thanking you and the Foreign Policy magazine in partnership with Chemonics for organizing this important event. I'm thrilled to be here to represent the U.S. Agency for International Development, or USAID, but also even more impressed by the other illustrious colleagues who will follow on the panel. I will just touch a little bit on our work with supply chains, because it's such a crucial part of what we do in the Bureau for Global Health and in our health work globally. Since our first contraceptive purchase in 1968, USAID has really been a world leader to ensure that quality assured, effective health commodities reach patients and save lives. We know that commodities are essential, as you said and described, to everything we do in the health sector, to USAID's goals, to country goals where we work, to the Sustainable Development Goals, and to universal health coverage. While we ultimately want to see countries fully managing and funding their supply chains and commodity needs, this foundational aspect of health systems work has really long been a focus of our work in the health sector and a comparative advantage for the Bureau for Global Health and USAID. I will note we have an incredible team of globally recognized experts, both here in headquarters in the Bureau for Global Health, in our missions in the field, who are complemented by technical experts based in our missions and also our implementing partners and then counterparts in the countries where we work. In large part, thanks to the American people, in the last year alone, we delivered 1,229 different products valued at almost $846 million to 70 countries. We supported 17.2 million people on antiretroviral therapy, protected 94 million people from malaria with mosquito nets, and supported the provision of an estimated 19.2 million couple years of protection as part of our work on family planning and reproductive health. We also work to strengthen supply chains in the countries where we are to be more resilient and independent to serve clients both today and tomorrow. So you asked about some of the ways we have adapted to the crisis.
I guess before, Carrie, before you answer that question, give us a sense. So in the last year, what were the biggest risks or challenges? I mean, I imagine, you know, in countries in the developing world that were completely shut down, like take India, for example, which had one of the toughest lockdowns or the most stringent lockdowns in the world. I'm just struggling to imagine, how do you even, under those circumstances, how do you continue to supply people with, say, mosquito nets or contraception in the ways that you could do under normal times?
No, and I think you touched on the equation between vulnerability and the need to manage those risks and resilient systems. And ultimately, what we are trying to support is the development and assurance of resilient systems. So I'm really proud of the way our staff and our partners have managed throughout the past year and a half. In addition to responding to some of the urgent needs like personal protective equipment, PPE, or oxygen and vaccine preparation, we really prioritize the continuity of essential health services. Those really go toward our three goals of preventing child and maternal deaths, controlling the HIV/AIDS epidemic, and combating infectious disease. All of that is in the context of responding to the pandemic, developing more resilient health systems, and also addressing global health security. So as I mentioned, even though something, you know, like the terrible impact of the pandemic is a relatively rare event, we know that there are risks inherent in every part of even routine supply chain management. So even before COVID-19, USAID was implementing strategies to minimize risk in terms of our supply of health commodities and our work with countries to ensure they were able to manage their supply chains. And those same strategies really served us well, both before, during, and we envision after the pandemic. For example, one of the strategies we use to mitigate risk is to keep inventories of certain products at regional distribution centers. So again, those stockpiles are there for emergencies, but also in anticipation of future orders. And that forward ordering and holding strategy gave us some flexibility to address uncertainties as manufacturers' production capacity dropped, especially during the early stages of COVID-19. I would also say that we've worked to expand our supplier base, including that we have partners who are suppliers in low and middle income countries who meet our quality standards. This enables us to promote manufacturing closer to where the patients are and given us greater flexibility for sourcing, which I think is so crucial in the times of crisis, such as the COVID-19 pandemic. Sure. And I think that in addition to diversifying those sources of products, we have recognized the need also to move further up the supply chain process to really diversify the base of suppliers for the API, the active pharmaceutical ingredients or other key starting materials, the KSM, that go into those commodities. So some of these are more based on practices we already had in place. Some of them are more medium term, and some of them are clearly longer term strategies to help
Sure.
adapt.
I'm going to ask you to explain what API and KSM is for our viewers who may not know those acronyms. But as you do that, also let's talk about technology. I'm curious what role tech and data, again, especially in parts of the world that are coming online, where people are beginning to use smartphones more, and therefore we have more data on their consumption patterns, on their geographic patterns, where they're moving, seasonal workers. There's just a lot more data now that developing countries especially are armed with to be able to plot out the course of a year, to be able to plot out healthcare strategies. So what is USAID's role in that process, and how does tech and data inform what you do today?
Yeah, that's a great question. And it is fairly incredible, the wealth of data that is at our fingertips. And I think one really critical investment we've made and we are making is strengthening the country level information systems. So those capture and report inventory and demand data at every level of the supply chain. We want to increase the visibility on those data and information to let countries and procurers really respond quickly to supply imbalances and prioritize areas at the greatest risk of stockout. So a lot of what we do here in headquarters at the Bureau for Global Health is really coordination with other donors and host countries to adopt some of those innovations or technologies. And one real illustration is the global standards, the GS1, for product identification, barcoding, and data exchange. So these are a common language for identification, for data capture, for data exchange, and really can serve as the basis for global trade verification and traceability. We really want to work toward having that end-to-end data visibility and tracking health commodities from the manufacturer all the way to the beneficiary. So clearly technology has a crucial role to play as we do that. And sorry, I skipped your question about the API and the KSM. Those are really the key elements or ingredients that go into the production and manufacturing of those commodities that ultimately we are trying to get into the hands of both first the health facilities and then the clients of health services. So
Sure.
I do think that, as I mentioned, a lot of what we do is coordinate and work on various donor platforms globally to help advance some of these issues, for instance, around traceability of pharmaceuticals. And we are doing that with multiple other donors. Again, one illustration, we're working with UNICEF, Gavi, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and the Bill and Melinda Gates Foundation on something called the Global Trust Repository that will, for instance, allow for COVID-19 vaccine carton or case verification at provincial and regional levels of country health systems using that GS1 or global standard that I just described. So it's a way for us to leverage our technical assistance over the last several years, something we've worked on, again, through global platforms in collaboration with many other donors and countries, and really create those reforms that enable the countries to be able to use those systems and thereby increase their visibility on the commodities as they're moving through the supply chains.
Sure. I want to remind our viewers that you can ask questions of Carrie as well. There's the Q&A button on Zoom. If you're watching us on Zoom, just tap it, tell us your name, where you are writing from, who you work for, and I'm happy to pose questions that are relevant to our discussion here. And you can also email us at events@foreignpolicy.com. Carrie, I'm curious about sort of last mile connectivity, again, especially in parts of the world where, that have large rural populations that are not very well connected. parts of the world where, for example, refrigeration is a problem, where, for example, the transportation of vaccines can often be difficult in many parts of the world. What is USAID's role in sort of advising or helping in those sorts of situations?
So again, much of what we are doing is moving countries into a more stewardship role in the government of those countries. And one way in which we try to do that is ensure we also engage, for instance, the private sector, which also has incredible experience and expertise and insights into that kind of last mile delivery that you were speaking about. I do think that in addition to the technical assistance we provide in almost every country where we work to develop that capacity and build the supply chain system, we're also really drawing on private sector practices, say in sales and operation planning. And some of that has been to develop tools like scenario planning around supply chain recovery. How can we draw on those practices and experiences from the private sector, and also from technology, as we discussed earlier, like a geographical information system that enables us or countries to identify facilities that might be at risk of stock out, where there may not be the coverage or reach that you referred to. I think that, for many years, we've been in a public-private partnership with, for instance, the Coca-Cola Company and its foundation, also working with the Bill and Melinda Foundation, the Global Fund, and the President's Emergency Plan for AIDS Relief, or PEPFAR, to, again, leverage that expertise of the private sector and the Coca-Cola system, in this case, to improve access to life-saving medicines throughout Africa. So that's been a tremendous way in which we've tapped into the private sector and really drawn on their expertise to be able to achieve that last mile distribution. And we're doing the same kind of approach for the COVID-19 response, and looking at how we can build on those kinds of approaches and expertise from the private sector to complement the technical assistance and other models that we develop through our programs more directly.
Sure. Let me bring in some of our viewer questions. Again, I'm always struck by how intelligent these questions are, because our viewers for these events tend to be policymakers and practitioners. So Jose Palacios wants to ask you, Carrie, about intellectual property. Resilience on the part of USAID when treating IPs, when it comes to supply chain shortages, lockdowns, and the impact it has and is continuing to have. So how does USAID adjust to the challenges imposed by intellectual property rights? And as you mull that question, I also want to name check Bridget Kakuros. Bridget is a joint postdoc at UC Berkeley and the University of Cape Town. Bridget's question is, in what ways does USAID measure or monitor resilience as an indicator of health system functionality? Is there a measure? So two questions there. Sorry to throw them both at you at once.
So, in USAID, we talk about IPs as our implementing partners who are so crucial. In terms of intellectual property rights, I think that's a fairly technical or esoteric question, and I don't know that I'm the best person to provide the response.
Carrie, I may have misread that. I think
Sorry.
Jose meant implementing partners. So let's go with that.
So again, a priority for USAID is the safety and security of its staff and its implementing partners. So clearly, we are working closely to ensure, and I presume we're speaking again about the COVID-19 pandemic context. That has to be a factor. And as you can see, I'm speaking to you from my home and not the office. And in many countries where there's been lockdown, obviously we and our staff respect that. I will say and this goes a little bit to the second question when we're speaking about the resiliency of the supply chain and other systems, I do think the political will was so crucial when certain governments enabled supply chain workers across the spectrum to be designated as essential workers, and that they were able to then, with the proper protection, continue to enable and ensure the movement of those crucial health commodities. So I do think that obviously the protection of the IPs, the implementing partners, and USAID staff globally has been a priority. And we've been taking the same measures in terms of remote working and masking and social distancing and all the other measures. And when those are at play in a country, obviously we want our implementing partners to respect those and follow those public health measures as well. And then of course, vaccination is another way in which we hope increasing numbers will be able to protect themselves. I do think that when we talk about resiliency, we really need to look at the whole system across the spectrum. I do think that, we need to have an overall resilient health system and really ensure the whole ecosystem is transparent and accountable and able to withstand shocks. So I think that those are some of the ways in which we are looking at that question on resiliency.
And just to follow up on the question of how to measure supply chains and to measure resilience, Alia Bass in Toronto, she says, she's following up on your answer to that about GIS data. She's asking what else are municipalities and communities looking for to help them sort of monitor supply chains? Are there any specific performance metrics?
So I think we'd have to follow up with the specific performance metrics, but we are providing tools and resources to those who work on the supply chain to really plan for and prepare for shocks. And there is something we call a playbook that's been developed. And then a large part of what we do through our work on supply chain is training, and in line with the technical assistance. Typically in a year, we would train about 20,000 members of the supply chain system. That was obviously affected a bit by the pandemic, but it really is also quite country specific in terms of where the country is and what those indicators or specific measurements or metrics would be.
Got it. Well, Carrie, thank you very much. I know you have a very busy schedule and day today, and I think I've gone over our allotted time a little bit, so I can't thank you enough for sharing your time and your insights. Look forward to following how the Bureau for Global Health and USAID will continue to address the challenges surrounding the strengthening of health supply chains globally. Carrie Pelzman, thank you. Okay, let's now welcome to the program our next speaker, Dr. Grace Adea. She's a public health physician. She's the malaria director at Chemonics and currently serves as the Malaria Task Order Director for the USAID Global Health Supply Chain Program Procurement and Supply Management Project. Dr. Adea has more than 25 years of professional experience, including 15 years managing multi-country health programs related to global health. Hi, Grace. Thank you for joining us.
Good morning, Ravi. Nice to be here.
Thank you for your time. I've had malaria 3 times. I was telling you before we started this event. It was 5th grade, 6th grade, and 7th grade when I was growing up in Calcutta. I can joke about it now because I had access to healthcare. I'm still here. I survived it. But of course, this is such a serious disease. And I guess before we talk about the last year and what we've learned from the last year, Just share the numbers with us a little bit. I mean, it's my understanding that just under 1 million people die of malaria every year. Is that right?
Yes, I mean, that's right. And thank you, I think, for introducing the discussion from that personal perspective. I think one of the reasons I was actually attracted to working in the malaria space is because of the number of people who are impacted globally each year. And the fact that it's really the most vulnerable people in the poorest parts of the world who are impacted, they don't have the kind of voice others have. So there's no one who's speaking on their behalf. And I think that has been one of the biggest challenges we've faced within the malaria space for a really long time. I think for the last 10 years, the PMI, President's Malaria Initiative, and the Global Fund started putting additional resources and global focus on malaria. We have seen the decline from what was almost 1 million cases, 1 million deaths each year, to about 400,000, a little over 400,000 each year. And that was as of 2019. So the key concern with COVID over the last year has been what has been the impact of all these lockdowns and the impact in the supply chain disruptions on the successes that we have achieved over the last 10 years. So if we can keep things at a steady state, we're much better off than if we've actually reversed. And I don't think we'll be able to see the real data on the impact for another year or so. But if we can keep it to that 400,000, and if we have achieved, we've been able to reduce it even further within the context of the COVID campaign, I think we would all count that as a success. It's really unfortunate when you say 500,000 deaths is a success, but that's where we are with malaria, and we'd definitely like to improve that a little more.
Of course. I'm wondering what the impact of the last year of lockdowns around the world has had on the impact on the supply of products that we need to combat malaria. So I'm thinking of mosquito nets, which I grew up using, for much of my childhood. The medicines, of course, Lariago, Lariam, all the medicines that go into making the antidotes to malaria, as it were, but also the right kinds of sprays, or the things that sort of prevent mosquitoes from coming into people's homes. All of that. How has the supply chain for all those products, medicines and preventatives, how has that been impacted?
It has definitely been impacted. We have seen across the different product categories differential impact. I think the key point to remember is our primary, I think Kelly mentioned API and KSM. Our key starting materials for malaria, the key product for treatment of malaria, artemisinin, comes out of China. Almost all our suppliers that we rely on come out of India. We've got some diagnostic test suppliers in the US and South Korea. So it was really interesting to see as COVID started in China, moved to Europe, moved to India, that sort of rolling impact on the supply chain did impact our ability to move products out of our countries of origin. And by the time we were ready to move them into the countries of destination, those lockdowns were also happening. That's not to say that we were not able to eventually address these issues. I think there was a really great global partnership that arose under the auspices of WHO, PMI, and Global Fund. We were able to convene as key global partners and have these coordination discussions where we were able to prioritize deliveries to countries that had the biggest need, the countries at most risks of stockout. So we'd use the limited available production, limited available malaria commodities, and focus prioritizing getting them to those particular countries and allowing, so that we're sort of doing a cascade effect. Go where the need is greatest. Once you've addressed that need, move next. But the other impact was really from the supplier perspective. And I think I'll give the example of the diagnostic test kits, because I think that was one of the biggest challenges last year. Essentially, the COVID diagnostic test kits uses the basic template. The test kits we use for COVID, HIV, malaria are essentially the same cassette. They're made by the same suppliers. When COVID came up, there was a lot more money to be made from COVID. There was a lot more market, a greater source with COVID. Malaria is a small relatively smaller. It's, the kind of profits or the kind of what you
And it's
gain
also
from,
been around for so long
yes,
that people have become inured to,
right.
it's not news that people die from malaria.
Yes. So that actual impact, we had to sort of convince suppliers that, there's a public health need to stay in the malaria space. We need you. We can't afford to lose you at this point in time. We do need you to keep making malaria supplies. So that actually was an effective discussion. We were able to keep the suppliers we need in the market, even as they continue to provide COVID supplies.
Right. Grace, I'm curious whether, I'm curious whether, so much has been made of the scientific advances of the last year. In a sense, developing the vaccines for COVID is kind of miraculous. Are there any lessons there from the last year? It's always, when we go through so much pain as a community, we're all looking for, okay, well, what did we learn from this? Are there lessons that we can apply to other areas? And so I guess, will the fight against malaria or even other diseases like HIV, are there some gains, some lessons we can learn from the last year of the pandemic?
Yes. I think the biggest lesson is when you have the resources and the political will and it's focused on a problem, it does get resolved. The reality though for malaria, I'll come back to malaria, the vaccine development that we saw with COVID did prove that, there are really great new innovative technologies. The mRNA technology was really, I think, the biggest driver for the reason we've got COVID vaccines as quickly as we have. I know there are efforts out there right now to apply that same technology to malaria and HIV/AIDS. I think the key challenge for malaria vaccines has always been parasites are more complex entities, organisms than viruses. They're more antigens. It's more difficult to find a sort of an immune profile that will confer long-term immunity. So we have to be a bit realistic as to whether or not we'll be able to apply that COVID vaccine lessons to malaria. But we ultimately don't need a vaccine in malaria that's 90% effective. It would be fantastic if we have that. Even if we have one that's 50, 70% effective, that can be an additional arsenal in the tools we're using for malaria. So anything we can get would be a step forward. And I think COVID vaccine and the COVID lessons have demonstrated that we can do this if we have the will and are willing to apply the kind of resources we did as for COVID.
Well, I think you've said it so well, Grace. We have the know-how, we have the resources. Sadly, we have not shown as a global community the will so far. But if that is the lesson to learn from the last year, that we just need to focus our minds on combating malaria because it's possible, I hope all the people who are listening to this conversation, all the policymakers, all the people in power, I hope they take your words to heart, Grace, because this is a disease that affects hundreds of millions, kills hundreds of thousands, and absolutely should be eradicated. Dr. Grace Adea, thank you so much for your time. Dr. Adea, of course, Malaria Director at Chemonics, Malaria Task Order Director for the USAID Global Health Supply Chain Program. Her work, as you just heard, is incredibly important for an incredibly important disease. Okay, let's proceed with our next conversation. Again, would love to hear your questions as part of this hour-long event that we have, the Q&A button on Zoom. I see many of you have been sending in your questions. I'm going to try and bring them in, incorporate them into the discussion. Just to name check some of you, I see you, Mikhail Mikhailov, Clivet Maiba, Wei Lang, Dr. Raju Chandrasekhar, Martin Ellis, Konal Jarvis, Abby Pratt, so many more of you. I see dozens of questions coming in. I'm going to try and pick a few and put them to our panel. But let me introduce them first. Esteemed panelists, some of them are in America, some are outside of America right now. So good morning and good afternoon to you all. Their names are Juliet Anama. She is the chairwoman of Jumia Nigeria and an independent non-executive director at Imperial Logistics. Dr. Jamila Kadi Cabral. She's the WHO representative in Angola, and Dr. Amit Thakur, he's the executive chairman of Africa Health Business. Ladies and gentlemen, if you can put on your microphones and your cameras, there you go. We can see you now. Welcome to all of you. I'm looking forward to exploring with you how lessons from COVID-19 so far have spurred innovations and improvements in global health supply chains. Jamila, let me begin with you. And if you can give us a sense of how at the start of the pandemic, over the last few months, the last year, how have supply chains where you are been adversely impacted by the pandemic? Trying to see if we can get Jamila. Can you hear us? Dr. Jamila Qadi,
No,
can you hear
I have
us?
some issues.
Okay, you have some issues. We can hear you now.
The last part of your questions.
Okay,
what
my
are
question.
The impact?
Yeah? Yes. So where you are in Angola, my question was if you could give us a sense of how health supply chains specifically, how badly they were impacted where you were. Just give us a sense of the scope and scale of the disruptions.
So thank you very much. I'm so pleased to be here to discuss supply chain resilience in the world, but global supply chain resilience. As you know, this is part of the health system, and for WHO, it is part of what we need to do to ensure and to promote universal health coverage, which is our main goal and aim. So in Angola, and I think that in many other parts of the world, the impact were tremendous in all areas. I will give some examples just to make it more concrete. For example, we had suspension of all travel. So we don't have transports. We don't have flights that come to Angola, for example. We don't have boats that transport that come to Angola. So that the result was that we had an increase in the price of the transportation, but also not availability. Even if you have money, it was not possible to order or to receive, or you can order, but you don't receive it in time or on time. So all that disrupted the system the system already was not that strong, because as you may know, our system are weak, are vulnerable. So we work like counting in many assumptions, but when this assumption doesn't realize,
then it's
so
a domino
all your
effect.
work just drop down. So
right.
Just that issue of not having transport to bring goods to the country. So many others impact. For example, and not only for COVID. COVID brought new needs. COVID brought even needs for things that we don't use to buy too much, like PPEs, like even respirators, like even all those lab equipment. All African countries became able to do the PCR, but before COVID, it was only 2 countries that were able to do that. So all these new needs for COVID was new, but we continue having the same needs, like Grace was saying, the same needs for malaria, for HIV. We continue to have those needs that also are affected by by all this impact of the COVID.
Right. So I hear you, and I imagine what you're describing in Angola rings true for people in many countries in Africa, but also around the world. Let me bring in Amit Thakur. Amit, I know you've sort of been very involved in public-private partnerships before the pandemic, but also during the pandemic. Tell us a bit about that, but also let's start pushing now towards what parts of the health supply chain actually worked during the pandemic. Give us a sense of lessons that the world has learned, or areas that have outperformed.
Yes, thanks, Ravi. Great to be here. This pandemic is literally a wake-up call. And if you look at what we've learned during the pandemic is we need to be self-reliant. Everything virtually came to a standstill. Everything in essential healthcare, essential commodities. If we were not making it in Africa, in our country, we had an extremely difficult time. You know what? The supply demand curve changed so dramatically that commodities were being charged at 10 times the price. And this is where you hear issues like why did we buy PPE at 10 times the price? Because it was simply not available. I mean, you would get from South Korea, people would be buying it at 10 times the price. And after 6 months, the prices had dropped because things had opened up. What did private sector really do and where did PPP really come? I think it's really around two areas. One was service delivery, PPP, and one was supplies. Let me talk about supplies, more relevant to the conversation we have here. The distributors around Africa are really agile. And as you know, up to 88% of most commodities are imported. And in pharmaceuticals, it's even more. There's very little manufacturing and supply on the African continent. In fact, the president of Uganda said that he's very happy that the pandemic happened at the World Health Summit opening because it's a wake-up call and Africa has been lazy. So we take it
Well, a
upon.
very costly wake-up call.
Look, he says it's a costly wake-up call. So we suddenly repositioned all garment manufacturing companies to start making PPEs. Guess what? 80% of the PPEs in some countries are locally made now. We never had companies making masks. We wouldn't even know what a machine of masks looks like because it was so easy to get masks from China. Now we have people investing not only in surgical, but even in N95 and KN95 masks. So this repositioning has created this industry that never would have existed because of the pandemic. And finally, on services and diagnostics, what we did through PPP is let the government know that PCR testing and lab reagents and lab equipment don't need to be limited to government facility. This dramatically changed the number of tests we could do in Africa. From 1 or 2 labs in certain countries, now we've got 70, 80 labs doing it. So it multiplied the tests and we were able to curb part of the spread just simply about this PPP model on getting both public and private doing tests, getting supplies, and of course, in vaccination drive, private sector hospitals are now doing that in offering their services at no cost so that we can reach a quicker access to the population. So I think the PPP has been the most powerful formula, and I think it's the biggest secret in making us reach this economic opening in Africa. Thanks.
Well, speaking about one of the P's in PPP, private, let me bring in Juliet Anama. Juliet, you're CEO of one of the largest e-commerce sites on the African continent. And, e-commerce has just had such an amazing impact in many parts of the world where, in areas where last mile connectivity didn't exist, e-commerce companies have not only been able to sort of bridge that gap by building over it essentially, but they've also allowed smaller stores to be able to sell on these e-commerce platforms. So it's sort of a two-way process of buying and selling. I'm curious, given your experience developing private sector supply chain logistics, what lessons, as you look at the last year, as you look at the struggles that so many countries have had in being able to fix their supply chains and being able to make them more resilient, what lessons can the private sector offer?
Thanks, Ravi. First of all, just a correction: I'm chairwoman, not the CEO.
Right.
I was the CEO of Jumia Nigeria, so currently now I'm the chair. Yes, that's a great question, and thank you for giving the opportunity to talk about that on this webinar. Yeah, so one thing was very clear during the pandemic: e-commerce itself as a business model was a key part of the resilience because when you had multiple lockdowns and restrictions, especially in the countries where we operate, 11 countries where we are, in a lot of cases, it was only through the fact that e-commerce was exempt that consumers could get basic hygiene products. We're talking, Amit talked about face masks. We talk about even hand sanitizers and all of that. So just because e-commerce itself could operate with an exempt status, then consumers could get those kinds of products. A lot of other areas, even in terms of sourcing, at the initial stages when it was very difficult to get things into the countries before the local manufacturing then kicked in to produce those products, we could also use the muscle that we already had established further down in our supply chain through China and other sources to bring in things like face masks, because like Dr. Amit said, there was a lot of price gouging, and the only way we could ensure that consumers were going to get things at the right cost and price was if we had to step in and do the procurement ourselves for those kinds of items. But then another thing I would say, that's on the supply side. At the end of the day, supply chain is driven by demand planning. Another area where we in e-commerce did a lot in terms of helping to build a much more resilient supply chains was on the demand planning side for the sellers on our platform. So being able to give a seller who has limited resources to plan for all the SKUs that he has, being able to give him information on the kinds of SKUs and the number of page views he has on those particular SKUs, and therefore which ones to concentrate on, providing them with what we call Jumia fulfilled by Jumia, which is really telling them which of their SKUs should be in a local warehousing capacities that we've kept for sellers. It helps them to plan and therefore prioritize what parts of their entire inventory, which particular SKUs in the entire inventory they need to concentrate on having locally on hand, and also planning deeper down in terms of local manufacturing. So there are quite a number of ways in which I think the lessons from the private sector that came out of that experience last year.
And SKUs are stock keeping units?
Stock keeping units, yes.
Okay,
yeah.
All right. Excellent. Let me come back to Amit. Amit, I'm curious whether, what lessons you think governments have been able to learn. So you mentioned, how so many countries can now produce their own PPE. But that's this crisis. What about the next crisis? How quickly now are governments able to sort of produce other things that we don't even know what they're going to need to produce? So ultimately, that is, I guess, the core of this discussion. Where sort of, how do we future-proof health supply chains for countries?
Right. I think this is going to test and it'll separate men from boys. And the governments that take true partnership and they have true leadership at the Ministry of Health and maybe at the presidential level will now start separating the zone 1 and zone 2 countries, and they will change the entire health of the citizens based on how you leverage effectively partnership. And we've been saying this for a long time, and we saw it. Those countries in Africa that had good public-private dialogue, I'm just talking about simple things like dialogue and engagement, changed the health of millions of people in their country.
Can you give us an example?
So take an example of Kenya is an example. Through public-private dialogue, we have been engaging and we signed a memorandum of understanding of us contributing to purchase vaccines from the same place the government is purchasing. So they are getting 1 million Johnson and Johnson in August. Guess what we did? We collected $12 times a million. We gave $12 million to add onto the government kitty. So we'll get 2 million doses of vaccines. And that only happens if there is trust and dialogue. We'll open up our economy faster and maybe twice faster because there's public-private dialogue and there's engagement. Same things I can talk about in Uganda. We can talk about a similar model in Nigeria with the Healthcare Federation of Nigeria. So I believe governments and leaders that leverage on partnerships on both public and private will definitely make a dent on health outcomes. It has proven and it is shown. Those governments who think that maybe it's only the ministry going to manage everything will find itself decaying in the health outcomes.
Juliet, let me bring you back in. What do you see as the biggest needs and priorities for funding and innovation? Again, I think the private sector perspective is very important here because you must look at state-run supply chains and see inefficiencies. So if you were to advise governments, countries where you've worked in, what is your sense of where the priorities lie?
I'm going to take it off from where Dr. Amit left off, which is really around being now, instead of reactive, being proactive around managing the supply of certain essential health products. So what should be localized? So those kinds of conversations around what kinds of products do we need to have a local manufacturing base for it? And therefore, if that doesn't exist right now or is existing, but in a very limited capacity, we need to start to increase that capacity now. So those kinds of conversations need to happen. That's where I think the priority needs to go to. Number two, now it needs to be about being very intentional about the things that would trigger and accelerate demand for certain items, whether it is in terms of the next wave of this pandemic, or it could be other health events that would happen. But all of that needs to be proactively thought through and then planned for. And thirdly, I couldn't agree more about the partnerships. I certainly couldn't agree more about the partnerships. It's very, very important to bring in multiple partners within private sector and public sector. Also, I recall that in Nigeria and some of other countries where we operate, even partnership around just disseminating information to consumers about disseminating information about myths, because at the early stages there's so many myths about COVID that were spreading. So we were partnered with government and we're providing information debunking a lot of those myths on our platform, and then also followed up with providing information direct from the government on what people were supposed to do, social distancing, washing of hands, and so on and so forth. Even things like that, utilizing the fact that we have so many consumers who use our platform and government has information that they need to pass to consumers, and using that in a partnership mode was very helpful in the countries where we operate. So, and then beyond that, also leveraging what are the capacities that exist within private sector. Last mile capabilities exist with companies like Jumia, for example, and other capabilities of warehousing and distribution with Imperial Logistics, for example, in South Africa, Nigeria, and other countries where Imperial is based. Those kinds of thinking need to be now intentional and proactive.
That's fantastic. I think you just answered a question that came in from one of our viewers, from Dean Batuma. He was asking about priorities, public-private partnerships, how to build strong resilience. I'm also going to name check a few of our other viewers who've asked very interesting questions. Dorothy from Hanoi wants to ask about the whole panel's experience supporting developing countries in building supply chains, resilient supply chain systems, how to maintain routine health commodities and service delivery when a system is overstressed. Nathan Rudd has a point/question, which I think is a great one to put out to all of you. If there's any one part of the global supply chain, the global health supply chain that performed well throughout the pandemic. I know some of you have touched on that already. And Clivet Maiba also had a question along similar lines. Conal Jarvis from Fort Francis, Ontario. Jamila, I'm going to bring you in on Conal Jarvis's question. which is how do we overcome last mile vaccine distribution challenges? One issue made clear by COVID in Canada, she says, is the issue of getting appropriate freezers for vaccines in rural communities. So how is this challenge being addressed in other parts of the world? Jamila, any thoughts?
So thank you. Specifically to vaccine, you know that we have a very strong experience with polio. So we were able to provide vaccine for everybody, everywhere. So I think that most of our country are building in the experience of polio to get the vaccine closer to the population. And of course, there is the big issue of supply chain, how to make this vaccine arrive close to those who really need it, especially the issue cold supply chain. So, but not all vaccines need a very special cold supply chain. It's only one or two. So what countries are doing is really using those who are easily managed in terms of supply chain to be taken to far, let me say. So, but this make me come to one of my concerns, and one of the things that I think that also need to be part of this conversation. Of course, we are talking about global supply chain, but this global supply chain only makes sense if it can arrive in people who need it. If everything that we are trying to manage, to transport, to manufacture, to distribute, arrive where people really need it. And the question on vaccine just give me the opportunity to raise the importance of having those who are on need involved in the process. We really believe that having these communities that need, the communities can support, and it's a kind of partnership. We are talking about public-private partnership, which is like a more structured and can happen in a more, let's say, national or maybe subnational level. But when you go to community, it can be also, it is a partnership that you have to develop with the communities to understand their need and to be able to respond to their need, or even put them, have them helping the system. Because what was said by Amit and Juliet is that the private sector is contributing,
right,
together with the government, to address an issue. So right. The same thing needs to be done also at community level, to have the communities involved and supporting and giving solutions to some of these problems, because all this system only have a sense if at the end these commodities arrive right where they are needed.
You make an excellent point. And in all of these discussions, especially for those of us sitting in places like New York and DC, we mustn't forget communities. We're almost out of time. I'm just going to put one last question. Amit, I'm going to bring this to you. It's from Maglor Archidi, a public health expert in West Africa. And his question is, how do you think, we just have a very quick answer, if you will, but how do you think the lessons learned from COVID and from the COVID response can be of benefit to other health programs and to public health in general? It's a good way to close out.
I think it's literally about improving efficiency, leveraging stakeholders like Juliet and Jamila mentioned in this. So I think all programs, malaria, TB, HIV, it's about get the right balance, use other stakeholders. It will reach more people and we'll have better outcomes. Thanks.
That's a great way to close it. Wise words. Unfortunately, we have to end this program here. I have to say, this has just been a really interesting and informative conversation. And to have your perspectives, Jamila, Amit, and Juliet, has been really important for us, especially given the work you do on the ground across the African continent. Thank you very much for your time. That was Dr. Jamila Kadi Cabral, WHO representative on Angola, Dr. Amit Thakur, executive chairman of Africa Health Business, and Juliet Anama, the chairwoman of Jumia Nigeria. I'd like to recognize Chemonics again for their support. That's allowed us to convene this important conversation. And thanks as always to our audience for tuning in. I hope you've gained new insights. Much more to come from foreign policy, including another virtual dialogue tomorrow, Wednesday, June 30th. You can see it on your screen. An equally important topic, climate change, food security, and how agriculture innovation can help us to ensure sustainable global food supply, but also cut global carbon emissions. That's farmers on the frontier of climate change. Tune it in at 11 a.m. Eastern tomorrow, wherever you are in the world. Find out more on this and many other foreign policy events coming up in the coming weeks on foreignpolicy.com/events. Of course, if you haven't subscribed to Foreign Policy Magazine already, please do. That's foreignpolicy.com. You can see the subscription tab on our homepage. Take a look at what we do. We hope you'll find it engaging and will be convinced to join us as members. I'm Ravi Agrawal, Foreign Policy's Editor-in-Chief. Thank you for your time. It's been a pleasure being your host for the past 1 hour. Take care. See you soon.